Hello, everyone. Very good afternoon to all of you. I'm Saimta from Men's Good Health team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: female urinary incontinence. Many women silently suffer from involuntary urine leakage, believing it's just a part of aging or something they must live with after childbirth. But the truth is, it's treatable, manageable, and most importantly, nothing to be ashamed of. To throw more light on the subject and guide us on female urinary incontinence, today we have with us renowned urologist Dr. Sharath C T. He is MBBS, MS, DNB Urology, Consultant Urologist, and he is currently practicing at Sparsh Hospital, Rajeswari Nagar, Bangalore. A very warm welcome to you, Doctor.
Good morning, everyone. Thank you for
Doctor,
the invitation. Yeah.
Doctor, as today we are going to talk about female urinary incontinence. What is urinary incontinence, and is it a disease or a symptom of something else?
See, basically, today I am going to talk on female urinary incontinence. See, as we know that, first we have to know what is urinary incontinence. So, urinary incontinence means it's an involuntary leakage of urine that cannot be deferred, that causes social or hygienic problem. So, see, we know that this is just a symptom actually. So, there are so many diseases that is causing the urinary incontinence. So, urinary incontinence can occur in both males and females, but as we know that urinary incontinence is more common in females. So, it's a involuntary leakage of urine that cannot be deferred. Okay, so that the incidence of urinary incontinence in females is around more than 50%. So, as the age advances, when women crosses more than 60 years, more than 50% of the women will have urinary incontinence.
Right. So
So,
it's
yeah,
quite normal for women to leak urine as they age or after childbirth.
yeah. See, basically, I want to tell about first what are there are different types of urinary incontinence. So, urinary
Okay.
incontinence includes stress urinary incontinence, urgency urinary incontinence, and mixed urinary incontinence. And there are some other types like total urinary incontinence and overflow incontinence. What is stress urinary incontinence? There is involuntary leakage of urine on coughing or straining. Means whenever they cough, whenever they strain, the intra-abdominal pressure will increase and that causes incontinence. So urgency incontinence means they have full bladder. They have a high tendency to pass urine. So there is a sudden compelling desire to pass urine that cannot be deferred. Means before they go to the bathroom with a full bladder, they will leak. They cannot control. That is called urgency urinary incontinence. And another is mixed urinary incontinence, where it occurs mostly in the age group after 50 or 60 years. They have combined features of stress urinary incontinence and mixed urinary incontinence. So, other than that, there are so many other incontinence like I told overflow incontinence. Those who have diabetic and neurogenic bladder, where the bladder becomes weak and bladder is fully distended, so they will leak. Their sensation is gone. That's why the patient will leak. And total incontinence, where they cannot hold the urine at all. Entire sphincter of the urethra gets damaged, where they cannot hold even a small quantity of urine. So whatever the urine produced from kidney that will not store in the bladder, it will continuously leak. That is called total incontinence. So these are the different types of urinary incontinence. Okay.
Okay, doctor. Doctor,
Hmm.
what are the main causes of urinary incontinence in women?
What are the? Can you
Main
ask?
causes.
See, basically, yeah, that is an important question. See, as I told, there are different types of incontinence. It may be urgency incontinence, mixed and stress incontinence. Age, age is one of the main common factors. See, after the age of 50 to 60 years, more than 50% of women will leak. That is like as the age advances, the they will attain menopause that causes urethral stenosis because of estrogen deficiency. So that is called once urethral stenosis occurs, there is bladder outlet obstruction. Large amount of urine gets stored in the bladder, so that bladder becomes overactive, hyperactive. That is called urgency incontinence. Or the bladder, as a over a period of time, that will lose its compliance and it become hypoactive, neurogenic bladder. That time it's called uh, that becomes overflow incontinence. So age is one of the factor. So as I told, stress urinary incontinence is most commonly occurs in younger age group in the period of pregnancy. So those who are attaining pregnancy at the early age group, 15 to 20 years, there are multiple pregnancies, more than 3 or 4 normal deliveries, and normal delivery with difficult normal deliveries like forceps is used, vacuum is used, and if there is a baby is very large and the pelvic inlet is very small. So these are the conditions where the female's pelvic floor muscles will be there. That pelvic floor muscles that is surrounding the urethra, that will give strength to the urethra so that it will maintain the continence. Means that will avoid the leakage. Okay. So once this pelvic floor muscles gets weakened, so that patients will leak. So the pelvic floor muscle weakness will occur in difficult pregnancies. What I told, that cesarean section and use of vacuum and forceps, all these things causes damage to the pelvic floor muscles. That time the pelvic floor muscles are weakened, the urinary incontinence occur. There is stress incontinence. There are some other medical conditions also can cause urinary incontinence. Diabetes histopathy, that causes neurogenic bladder and overflow incontinence. Patient having neurological conditions like multiple sclerosis, Parkinson's disease, spinal cord injury, spinal cord atrophy. These are all the conditions, neurological conditions that can also cause, that is urinary incontinence. That may be urgency or it's a overflow incontinence. And some other problems include there is radical pelvic surgeries. They have underwent malignancy. For malignancy, uterine malignancy, they would undergo radical pelvic surgery, irradiation to the bladder, the radiotherapy. So these are the other medical conditions that causes urinary incontinence. So there are different causes for urinary incontinence, and the causes are different types of incontinence. For each types of incontinence, there are different causes.
Right. So there are different causes in women that leads to urinary incontinence. Doctor, are there any
Yes.
lifestyle habits that worsen urinary incontinence?
Yeah. See, basically, urinary incontinence, as I told, as the age progresses, it's more than 50% of women will suffer from that urinary incontinence. So they will be having already some amount of urinary incontinence with lifestyle changes and whatever the advanced lifetime risk. This all causes increase in the incidence of urinary incontinence and the symptoms becomes more. The promoting factors, what I told is smoking. So smoking, alcohol, they will use lot of beverages. Okay, cola, Pepsi, all these things, and also uh, they will use stress is also more in this. So the stress also one of the reason, and these are the other precipitating factors. Okay, excessive use of coffee, tea, nighttime they're drinking lot of water. Okay, and so many other beverages, artificial sweeteners, recurrent infections in the bladder. So these are the promoting factors. Means they already have urinary incontinence, the symptoms gets exaggerated by these promoting factors. Okay.
We have seen a lot of women consuming tea and coffee at very frequent intervals. Do they also kind of worsen the symptoms of urinary
Yeah, so
incontinence?
definitely. So that's what I told. Coffee and tea, they are caffeine. They are basically bladder irritants. So that will
Okay.
stimulate the bladder. That causes overactivity of the bladder. Bladder become hypersensitive. So that causes contractions in the bladder, hyper contractions. That becomes overactive and urgency incontinence. Okay. So I will after that I will tell you the mechanism how this urinary incontinence can occur. Okay, I have one slide here, so I will show you. So you
Yes,
can
yes,
see the
please, doctor.
this is the urinary system. Okay, of the female. This is the bladder. This is the uterus. Okay, and this is the rectum. So this uterus and bladder will open into the normal vaginal opening. Okay, so I told the pelvic floor muscles. The pelvic floor muscles will be here around the urethra, and it supports the urethra and cervix. So basically, what will happen as the like during the pregnancy, okay, or any difficult deliveries and all, this around the urethra pelvic floor muscles gets damaged. So there are so many theories for stress urinary incontinence. Why the stress means whenever the intra, whenever you cough or sneeze, why the urine will leak? That we have to understand the mechanism why it will leak. Okay, so whenever we cough or strain, intra-abdominal pressure will increase. Abdominal pressure will be transported into the bladder. That is called intravesical. This is the bladder where urine gets stored. This is the intravesical pressure. So there is another mechanism where this urethra will be there. No, that intraurethral pressure will be more than intravesical pressure. That will prevent the leakage. But whenever, because of I told previous history of multiple pregnancies and difficult deliveries, so the this pelvic floor muscle will become damaged. The intraurethral pressure will be very low. So whenever they cough or sneeze, this pressure directly transferred here. So the urethral resistance become low. So whatever the urine stored here will leak out. The pressure will not generate here. So that is the
Right.
mechanism where the stress incontinence can occur. There are so many theory for that. Kelly's theory, Menger theory, D. Lancy theory, they will tell. So the pubococcygeal muscle, the urethral sphincters around the urethra, the pelvic floor muscles are called pubococcygeal muscle and pubourethral ligaments. That all the ligaments and muscles will get weakened. That's why they will not generate adequate intraurethral pressure. So whatever they hold in the bladder, and that will leak out when there is a increased abdominal pressure. That is first test urinary incontinence, what I told. Similarly, I told this is one of the part like stress incontinence. Urgency incontinence, how it will come? That is because of overactivity. There is a, I told some neurological conditions like Parkinson's, multiple sclerosis, spinal cord injury. In that, the supply of the neurons into the bladder will get disrupted. So bladder, what is the mechanism of bladder? Once bladder gets filled, the contraction will occur, bladder pressure will generate, that will cause contraction of the bladder and urine will come out through this. But here there is a discoordination of the neurons and muscles. So in a neurogenic bladder, like in an overactive bladder, the bladder contracts more. So it's continuously it will contract. Then it will automatically the pressure will increase in the bladder and the patient keeps on going to the bathroom so many times. That is called urgency. They cannot control. Pressure generated in the bladder will be high. So that is called urgency urine. That time they will go to the bathroom. Before going to the bathroom only they will leak out because of high pressure in the bladder. We will tell the complaints of the bladder. That is pressure and volume relationship. That pressure and volume relationship between the bladder and urethra will last. So they will have high pressures in the bladder. That is because of neurological conditions I told. That time, before going to the bathroom only, the patient will leak. That is called urgency incontinence. This is common in old age after 60 years. There is another condition where I told overflow incontinence. That is because of here the bladder becomes completely weak over a period of time because of diabetes or other some neurological conditions. The pressure will not generate. The bladder becomes completely balloon-like and there is no pressure in the bladder. The bladder will become hypoactive, weak bladder. That time around 700, 1 liter of urine gets stored in the bladder. So in that
Oh,
condition, the pressure will not be generated in the bladder. So that time the bladder will become filled with the urine. So that time also the incontinence can occur. That is called overflow incontinence. So these are the
okay.
mechanisms of different types of urinary incontinence. Okay.
It was very helpful in understanding the mechanism, doctor. Now, doctor,
Okay.
how can a woman identify whether her leakage is a medical issue that needs treatment and she should go and consult a doctor?
See, basically, that's what I told. There are different types I have told. They have to identify what type they are in. Okay. Younger age group and they had multiple pregnancies. If they leak out on coughing or sneezing, some people will be there like they will leak out whenever they get up from the bed or when they sit on the chair. Or some people will have severe incontinence. They can't even run or jog. Whenever they run, they will have leakage. So some amount of walking, very fast walking also can cause leakage. So there is a social problem actually. So many of the women, younger age group around 40 years, with multiple pregnancies in the before, it may not be like pregnancy also. So many other like before any surgeries also, they will have this incontinence. That incontinence, I feel around 70 to 80% of women will develop that urinary incontinence. But many people will hide that. They will not go to the doctors for this, okay, huh? They will think that is a normal phenomena. But if the significance is increases, means the leakages become very very much that they cannot go outside, huh? If they go to outside any malls or anywhere, they will they will use diapers also, like that will be there. So they have to
Yes.
identify that problem. If it's significant, better to consult urologist, okay. So other than that, I told this incontinence causes what, continuous leakage of urine cause wetness around the vagina, that causes cystitis. This is called urinary tract infection. They will develop dysuria, burning sensation, foul smelling urine, and there is a urgency, frequency. So many times they will go to the bathroom, and night time also they will get up so many times. So that may lead into the bladder dysfunction, and that may go into the kidney infection also. That is called pyelonephritis. Will tell. So as the age advances, that is all like urgency incontinence is more common. They will develop this type of symptoms. So in the younger age group, the incontinence will be like they will have continuous leakage or on coughing they will leak. So they have to identify that problem first. So they, rather than they should leave with that, they should consult urologist for proper
Mm,
treatment for that. Okay, that is the thing.
right. Right. And doctor, one thing that you also mentioned and focused on was the weakening of pelvic floor. And we know, of course, for all the reasons that you have stated, that over age and
Mm.
time, with age and time, it weakens. Are there exercises that we can start doing early in our lives to strengthen those pelvic floor muscles?
See, definitely. See, basically, conservative management, the management how they have to do by themselves, that is very important for the control of urinary incontinence. So, though I told they have those who had underwent pelvic surgeries or multiple pregnancies or difficult deliveries, they have
Hmm.
one exercise called Kegel's exercise. Okay, so that Kegel's exercise is one of the helpful technique so that they can improve the pelvic floor muscle strength. So whatever the pelvic floor muscles which are damaged during the deliveries, that can be strengthened by doing pelvic floor muscle exercises. So I will show you one of the chart in such a way that how the exercises will be done. Okay, huh? So you can see that here there are some
Yes.
pictures here. So you can show that they have to identify where is the pelvic floor muscles. Okay, so pelvic
Hmm.
floor muscles are around the urethra, like where they are peeing, that around that area, and the pelvis, that area is the pelvic floor, entire area is the pelvic floor muscles. So these are the exercises what I told. They have to lift the thighs and the pelvis, and they have to give alternative contractions and relaxations of the pelvic floor muscles.
Hmm.
Contractions it should be done morning, afternoon, and night. This pelvic floor muscles contraction for 5 seconds, relaxation for 5 seconds. Like that, they have to do 10 times. Morning 10 times, afternoon 10 times, and night 10 times. So this alternative contraction and relaxation of the pelvic floors, that causes strengthening of the pelvic floor muscles. Slowly over a period of time, they will the pelvic floor muscles strength will improve. So automatically the leakage will get stopped. Okay, but they should know how to do it properly. Huh? If they go and check it in the YouTube also, there are some videos. They will properly tell you where we have to identify pelvic floor. They should not stretch the abdomen. They should not stretch the thighs. Okay, and it's not like they have to do it continuously so many times. It's just morning, afternoon, night, 10 times they have to do. So it's alternative contraction and relaxation of the pelvic floors for 5 seconds. Okay, they have to maintain a diary, so that diary will help them how to like they have to mention that how many times they have done morning, afternoon, night, and how many seconds they have done. So if they do continuously for almost 6 months, that pelvic floor muscles will gain the strength, and they will automatically the leakage will subside. Okay, in more than 70% of the women.
Right. So these Kegel exercises or pelvic floor strengthening
Yeah.
exercises are there. Are there other exercises or physical therapies, doctor, that can help improve their bladder control?
See, basically, pelvic floor muscle exercises are the mainly the Kegels exercise only. That there are different types in that. That's all. Overall, it will
Right.
be a strengthening of the pelvic floors. So it is like alternative contraction relaxation of this anal sphincter. So they are all different types. That's all. But overall, they will improve the pelvic floor muscles. So mainly the exercise is the one which will help.
Right. Now, Now, doctor, when a patient comes to you with symptoms of urinary incontinence, are there tests or assessments that are done, or just by physical examination, taking history, etc., talking to the patient, you derive to the conclusion, or where you can set the line
Yeah.
of treatment?
See, definitely, once the patient comes with the urinary incontinence, we will properly take the history. History and physical examination is a must. So we have to assess which type they are in. They are in urgency incontinence, or stress incontinence, or it's a mixed or overflow incontinence. For that, proper history will help us to go through that. So based on the history only, we'll come to know that whether it is a urgency or mixed incontinence. Along with the history, we will ask for like other histories like medical conditions I told, any like neurological damage, any spinal cord injury, or any Parkinson's, or any other diseases like diabetes and all. And also we have to ask his parity and pregnancy history. What I told before, same number of pregnancies, birth weight of the baby, was there any used like forceps or vacuum delivery was done, was the like yeah, that was a cesarean section, a normal delivery, and it was uneventful or what, that we have to see any previous histories of irradiation, radiotherapy, or any pelvic surgeries they have done, that we will see. We will examine the patient properly with one attender. We will examine, or a nurse. So usually we will do abdominal examination and per speculum and per vaginal examination. In per speculum examination, we will see that, see how is the urethral health, like whether it is a stenosed urethra, or it is like any redness, ulcers are there, and we have to see for stress test, that is called cough test. We will tell them to cough in a half filled bladder, like the bladder should be half filled, and we will tell them to cough how much it is leaking, and it's whether it is significant, that we have to assess. Then we will see for prolapse of the organs like cystocele, that bladder gets prolapse, that means the descent of the organs like cystocele, enterocele, rectocele, apical prolapse, whether she has underwent hysterectomy before, that we will see. Okay, so mainly 40% of this stress incontinence is associated with prolapse of the organs, like I told, bladder prolapse and uterine prolapse. You can understand what is prolapse means. The organ, like either bladder or uterus, will come out through the vagina. That is called prolapse. That will be there in 40% of the incontinence patients. So that we have to correct. So when the prolapse is there, we have to correct both prolapse and incontinence. Okay, otherwise the incontinence will increase. Okay, so that we have to see. And we'll examine neurological conditions also. Is there any neurogenic weakness of the we have to do some reflex test and all is there, so that will assess whether it is a neurogenic problem. So or it may be a stress incontinence, that we will tell. And some tests are there, that is called q-tip test and Bonis test, and this test we will do to assess the angle of the urethra. See that incontinence I told, that is because of loss of posterior vesicourethral angle. The angle will get changed. I told this is the angle. So this bladder and this is urethra. This angle is very very important. This angle will last in stress incontinence. We have to check the angle. For that one Q-tip test is there. The angle is more than 30 degree. That means the posterior vesicourethral angle is last. So these patients tend to leak a lot like that. So that angle will be tested by Q-tip test, and we'll do Bonis test. The Bonis test is for stress incontinence, where we will check whether the we will compress the bladder neck, and we'll check that whether the leakage will stop with that. So that surgery will be useful or not, that we will assess with Bonis test.
Okay.
So number of pads, how they are using, is there any other blood in that, infection is there, that everything we will check it. Okay, and history and physical examination is very important. After that, we will do some tests also. There are some basic tests we will do before to going to treatment. Okay, the basic test includes urine routine and examination culture for seeing any infection is there in the urine, that we have to treat it. And then we have to come for ultrasonography, kidney, ureter, bladder. We have to check for residual urine. Means after passing urine, how much they're storing in the bladder. That is important. The residual urine is more, means more than 500, 600. That indicates it is a neurogenic bladder. It's a weak bladder. So in that condition, surgery will not be useful. Okay, so that we have to assess ultrasonography of the bladder is needed. Along with that, we will do uroflowmetry. There is a speed test. How in what speed they are passing the urine. That is important. And urodynamic studies is must for all stress incontinence and urgency incontinence. What is that urodynamic study? we will assess the bladder pressure. So it's a 1 hour study in front of the computer. We will put a pipe into the like there is feeding tube into the bladder, and we'll fill the bladder. So once the bladder is filled, the response of the bladder to the filling, that we will assess. That is called bladder pressure and volume relationship. So that detrusor pressure and intravesical pressure will be assessed. Based on the urodynamic study, we will come to know conclude that it's a stress incontinence or urgency incontinence or overflow incontinence. So based on that only we can take them for surgery. Whether surgery is useful or not, that is based on the urodynamic study. Okay, that we will do. We will do one cystoscopy also. Cystoscopy includes passing a telescope into the bladder, check for urethra. How is the urethra? Any narrowing is there? Bladder neck, whether it is hypertrophied. We will check the bladder completely. Is there any trabeculations, circulation, and is there any diverticulum? All these things we will do. Okay. So these are the
Right.
simple test we will do on OPD basis. Okay.
Right. So a lot of techniques, a lot of ways are there to diagnose and reach to conclusion. And from what you just told us, I can derive that medications, surgical and non-surgical methods are there to treat. Would you like to shed some more light over the treatment options available for female urinary incontinence, doctor?
Yeah, yeah. See, definitely once like the patient has come with the urinary incontinence, so mainly our aim is to make her dry. So it will be like it's a incontinence is one of the messy thing. Like they will continuously leak, or it may be intermittent leakage. The area becomes wet. So many infection will come, foul smelling, odor, all these things will be there. So if they become once they become dry, all these symptoms, whatever they will have problems, that will be cured. So our aim is to make her dry. So what are the medications which are available? I told the evaluation how we will do: history,
Hmm.
physical examination, do some scan and uroflowmeter, urodynamics. In that, after doing all these tests, we will come to the conclusion whether is a what type of incontinence, because each incontinence will have different treatment. We can't like for all patients we can't do surgery, or for all the patients we can't give only medications. It's all combination of medications plus surgery. So we will conclude that whether it is a stress incontinence, or it's urgency incontinence, or it's a mixed incontinence. So there are so many options which are available. I will tell you on based on the different types first. Okay. So if you come to the first, we will talk about stress incontinence, because many of the people in the younger age group will suffer from stress incontinence. So once we have diagnosed that it is a clear cut case of stress incontinence, no urgency or no mixed incontinence, no other comorbidities, it's mainly purely leakage is occurring because of coughing or sneezing. Once that is concluded, we will offer like first initially we will give a conservative management. In that conservative management, we will tell them do that pelvic floor muscle exercises in a proper way for 6 months. That kegels exercise and pelvic floor muscles exercise strengthen the pelvic floor, and it definitely give a good result. Like over a 6 months period they will become dry. Along with that, they have to do some lifestyle modifications. Lifestyle modifications includes same like avoiding smoking, alcohol, avoid beverages and all spicy oil items. All these things, along with that, belly floor muscle exercise is important. So with that, we will start with that also. If they are having leakage or incontinence is severe, we will grade them. It's usually grade 1 to 3. Grade 1 and 2 will be treated with the conservative management. But once the grade is high, then the conservative management will not help. For them, we will advise the medications initially. There are some medications will prevent the stress incontinence. Topical application of estrogen ointment that we will give. Along with that, we will give dapaxetin or duloxetine. They are the selective serotonin reuptake inhibitors. There are some medications, dapaxetin and duloxetine, that causes increase in the intraurethral pressure. That increases the pressure in the urethra so that it will avoid the leakage. With that medications, we will again will wait for 15 to 1 month, 15 days to 1 month. We give the medications. With that, there some people will become dry. So with that also, if they are not improving, means definitely we have to advise them as surgery. Simple surgery is there for making them dry. It's called TOT mesh repair. Mid urethral slings, they are called transobturator or transvaginal tapes. A small mesh will come. There is a tape. What it will do, we will just it's a daycare procedure. Morning they can admit, in the evening they can discharge like that. small incision in the vagina and we'll put a mesh in such a way that that will strengthen the pelvic floor. The around the urethra, this mesh will come and it will lift the urethra like that. See here, this is the urethra. So around this
Hmm.
urethra, so it will lift the bladder and urethra so that it will act like a pelvic floor. So it will give strength to the urethra. So this is simple mesh. So I am doing regularly this TOT mesh repair. More than 400 to 500 surgeries I have done of TOT and transvaginal tape mesh repairs. The patient become absolutely dry and they will be very happy. So that is called TOT mesh repair. There are so many other laparoscopic surgeries are there, Birch Calpo suspension and Marshall Marchanti transablation. Nowadays they are not doing all these major surgeries for stress incontinence. So gold standard surgery for incontinence is just a mesh we have to keep. That is a daycare procedure. With that the patient's results will be very good. Okay. So that is regarding the stress incontinence. So
Yes.
if you come across urgency incontinence, I told old age, urgency, overactivity. For that, medications like for surgery will not be helpful. They have to do the lifestyle modifications. What I told, same pelvic floor muscle exercise, diet,
Hmm.
avoid spicy alcohol, smoking alcohol, and other things. Along with that, we will give some medications to relax the bladder. Bladder is already hyperactive. Then we will give some medications that will relax the bladder. So in such a way, like we will give some anticholinergics, solifenacin, darifenacin, tolterodine, like that tablets. Along with that, sometimes we will give beta 3 agonist, that is called mirabigram. So we'll combine the mirabigram with solifenacin. We'll start with a low dose of 25 milligram. Then we will increase to 50 milligram of milligram. So combination of mirabigram and solifenacin we will give. So these medications, what is their action is they will relax the bladder. The pressure generated by bladder will be relieved. So this along with these medications, same along with that, we'll apply the topical application of the vaginal cream, that is estrogen cream, tricyclic antidepressant. So many medications are there. So with that, we can relax the bladder. So once the bladder gets relaxed, automatically leakage will come down. So there is another treatment for urgency incontinence. So usually with the surgery will not be helpful for overactive urgency incontinence. So there are some other things other than medication. If the medications also they are not improving. I'm telling about urgency incontinence. We'll give intravesical Botox. Botox is a botulinum toxin injection. That
Yes.
injection will be directly into the bladder. That the main action of the intravesical botox is that will also relax the bladder, that will avoid the contraction capacity of the bladder. So that intravesical botox is another option we are doing that. So if you come across a neurogenic bladder, I told overflowing continuous bladder becomes completely weak, completely hypoactive, where it will not generate the pressure only, but that time it become balloon like. Then also the patient will leak. That is called overflowing continence. That treatment will be difficult. Usually there is no medications to increase the contraction of the bladder so that it will empty the bladder and they will leak, avoid the leak like that. So in that condition, the neurogenic conditions, whatever the neurogenic conditions I told, spinal cord problems, Parkinson's, for them treatment will be difficult. Usually that occurs in the old age I told. So for them exact specific treatment for controlling the continence is difficult. So in that usually we will use some medications that will a little bit 10 to 20% improve the bladder contraction. Otherwise, they have to live with that as a CIC they will do. Means clean intermittent catheterization. So they have to insert the tube by themselves. That is catheter 4 hours once and night time once. So that will empty the bladder and they will be free in between. So that is the final option we have to give for neurogenic bladders, means overflowing continence and weak bladder. For them no other specific treatments are there other than CIC, clean intermittent catheterization, where they have to empty the bladder by themselves. So these are the
Okay. Hmm. Right. Now, doctor, can urinary incontinence be completely cured?
yeah. See, I told just now, based the types like stress incontinence can be completely cured. Okay,
Hmm.
so urgency incontinence can be cured completely.
Hmm.
But there are some conditions where the incontinence is associated with the neurological conditions. I told spinal
Right.
cord problems, diabetic, it is a multiple sclerosis. Neurogenic conditions cannot be cured. Okay, that's why I told that based on the types, stress incontinence can be completely cured and urgency incontinence can be completely cured. Other
A
types of
very
incontinence are cured.
yes,
That
doctor. A
they,
very
that
common confusion that females have is where should we go for help, to a gynecologist or urologist in case we have these, symptoms of urinary incontinence.
See, basically, as I've seen, many of the patients are referring from gynecologist for us because
Hmm.
they will feel that they have to go to female gynecologist for this type of problem because we are usually they will avoid male urologist for because they we have to do per speculum per vaginal examination. Many people, many females are not comfortable with that, but usually I will tell them, see, this is a disorder, they will go to female gynecologist also, they will refer to us only. So if the patient is suffering from the urinary incontinence, exactly they are having leakage, they are having urinary infection, then definitely they have to directly come to urologist, they, so that we will give a proper treatment to them and we will make them comfortable and dry. That is the one thing I will tell. Mm.
Right. Doctor, what advice would you give to women who feel embarrassed to talk about this issue? And it is still such a taboo issue to talk in our society, right?
Yeah, yeah. See, basically, the females, they are. Even I have heard that many of my patients, they were like they don't know where to go, and they doesn't know that it is a problem to them because many
Right.
of the almost 30-40% of women are living with that urinary incontinence, and they are
Hmm.
thinking that that is the normal, or they are shy, or they are having social hygienic problem to show that. So that is the one problem with them. So what I will advise them is definitely the urinary incontinence, if it's a milder form, milder degree, less grade, then they can treat them with the I told Kegels exercise and all pelvic floor muscle exercise. But they are
Hmm.
significantly suffering from that. Better to consult a urologist. Okay, because we have advanced treatment for controlling the urinary incontinence. They can become completely dry, they can become infection free. So as a over a period of time, once they become aged, so they we can avoid so many complications by treating the urinary incontinence, like they may go into bladder become completely weak, they will develop pyelonephritis, cystitis. All these things can be cured if they treated early for the urinary incontinence. So many of my patients have told once after undergoing surgery, they will be very happy. They are like completely dry, and they are telling that. So we didn't know that this type of treatment is there for female urinary incontinence. So that's what I am telling. So it's like it's a many of the females, they should be aware and there should be some education to them so that they can show that problem, they can show it to the urologist and they get cured by that.
Right. Doctor, before we wind up, what message would you like to give to young women about bladder health?
See, definitely. See, now young patients are coming with so many times they are repeatedly coming for urinary tract infection, burning sensation, frequency, urgency, foul smelling urine. These are the most common symptoms in younger age group also. Like 20, it can occur in any age group, but is most common in older age. Now the trend is going like in the younger age group also they are suffering from urinary incontinence and urinary infections. Basically, urinary infections are more. So I would tell them, see, basically they have to properly use the toilets. That is very very important. They can't use public toilets, unhygienic places for that. They have to flush it, clean that, and sit and do that. It's called ascending infection. Most of the women have urinary tract infection because of using commodes. They will directly sit over that. So they have to use the proper toilets, clean that private parts with a proper antiseptic solution, and plenty of fluids will help them. Okay, and they have to hydrate themselves, avoid stress is also another factor that will cause. And usually in the younger age group, they after sexual intercourse, they have to clean the private part and with antiseptic solutions, and they have to it's wide means they have to pass urine after that. That is very important. Along with that, they are suffering from, like I told, that any incontinence features, they are feeling that they are having severe incontinence in the middle-aged women. They can definitely do start like they can first consult the urologist, then they can start that Kegels exercise and pelvic floor muscle exercises, and they can undergo the treatment for that. That's what I wanted to tell.
Absolutely. Thank you so very much, Dr. Sharath C T. It was wonderful talking to you, sir. You have made this whole session so informative. Thank you for your valuable time once again.
Thank you for giving the opportunity. Thank you.
It was a pleasure, Doctor. Thank you very much. And viewers, thank you for your excellent participation. For more information and updates, stay connected on our YouTube page, Men's Good Health. We are also available on Facebook, Twitter, and Instagram. Thank you and have a great day ahead. Take care of yourself. Goodbye.